If you've had trouble getting prescriptions approved by your insurance company, you're not alone. 9 in 10 doctors surveyed say prior authorization is having a negative impact on their patients. News 12's Walt Kane looks at the system and why some say it needs to change.
If you take prescription medication each day, you know how hard it can be to get insurance to cover it.
You just call and you complain and you hope that maybe they messed up and they'll fix it.
So it's like I have to speak to the insurance company on behalf of what my doctor said. I have to speak to the doctor about what my insurance company said, where I wish they could just handle it.
When your doctor sends a prescription, it's typically reviewed by a pharmacy benefits manager, or PBM. PBMs are hired by the insurance company to decide what medications are covered. And doctors say increasingly they're delaying prescriptions by demanding more information or simply refusing to cover them at all.
They're playing doctor. I'm the doctor. They're not the doctor.
Neurologist Dr. James Charles says his staff now spends hours each week getting prescriptions approved.
Sometimes you're lucky it's approved in 2 days. Sometimes it takes 14 days. Then they say, no, we're not going to approve because it's not on our list.
Last fall, the Federal Trade Commission sued America's largest PBMs, saying they result in patients paying significantly more for life-saving medication.
Any day that I speak to a physician is a day that I hear a complaint about not being able to get care that's needed paid by an insurance company.
The Medical Society of New Jersey says there's some good news for patients. Under a new law taking effect this month, PBMs must now make prescription coverage decisions in 3 days, or just 24 hours if the doctor deems it an emergency.
Previously, they had up to 15 days, which is just inappropriate when a patient is suffering.
The Pharmacy Benefits Managers Association insists PBMs help patients, adding whether it's through negotiations to lower costs, partnerships with pharmacies, or clinical care programs, our value is in helping patients conveniently, safely, and affordably access prescription drugs. New York and Connecticut also have PBM regulations on the book, but they can vary widely from state to state. I'll put the list on news12.com. In your corner, I'm Walt Kane, News 12.